This 8-minute video will walk you through a full foam rolling session for the lower body as well as the upper back, designed to alleviate tension in the body specific to pelvic health conditions. Follow along in this video if you'd like to improve your technique and your breathing during an existing foam rolling session. If you'd like to learn more about anatomy and technique specifics using other tools in addition to a foam roller, such as a ball, you can follow along with our other video called Learn Self-Myofascial Release Techniques for Pelvic Pain, also in this YouTube channel. Of course, check with your physical therapist before foam rolling to make sure that this is right for you. When you're ready, grab your foam roller and I'll meet you on the mat for this brief 8-minute session. Position yourself seated on the foam roller, and with your hands back behind you, push weight into your hands and feet and shift your butt to the side so that you're just rolling on the right buttocks. Shifting the weight back and forth here, breathing as you massage this right piriformis and glute max, and then shift the weight over to the other side to do the same, rolling back and forth through the piriformis and the glute max. If this doesn't feel intense enough, you can pick up the feet, driving more pressure through the back of the body. And again, you're still rolled over towards your left glute. And when you feel like that's enough on that side, shifting your weight over towards the right glute and trying again here with this little bit of difference in pressure. Of course, if that's too much, keeping your hands and feet on the floor is best. Next, we'll roll our gluteus medius muscle. So coming onto the side of your body, you can position your top leg over your bottom leg to help you stabilize. And using your hands here to help you push the weight back and forth along the top of your hip crest here at your gluteus medius. To intensify this, you can stack your legs, and this will increase the weight going through the side of your hip. Continuing to move back and forth here, and exploring tender areas for about 30 to 60 seconds before you move on. And we'll switch sides here to the other gluteus medius hip muscle. Again, coming on to our side on the roller, positioning the roller above the outer hip bone, but below the top of the hip crest. And using that top leg here to help you stabilize as you roll back and forth, or stacking the top leg to help intensify what you're feeling in the outer hip. Take your time here, breathing deeply as you roll, making sure to keep that breath flowing throughout this entire practice. This will help to oxygenate the muscles that you are releasing. When you're ready, we're going to shift our position here to roll out the hamstring muscles on the backs of your thighs. Placing the roller behind you, you can lift the buttocks by pushing weight through your hands here and rolling back and forth. To intensify this hamstring release for one side, you can cross the legs, and this will put more pressure and force through that hamstring. Taking your time here before you switch sides. Rolling along the length of the hamstring muscles. And again, we're breathing here. Anytime that there's intensity with a foam rolling technique, the tendency is to hold our breath, which will not help the muscles to release. So making sure that you keep your breath flowing throughout this foam rolling practice is important. Next, we'll flip over and roll the quadriceps muscles or the thigh muscles on the front of your legs. Here you can use the forearms to help you roll back and forth, and keeping the legs straight here, using your abdominals a bit to help keep integrity in the core as you roll the thighs back and forth. Take your time and pausing in any areas that feel more restricted than others. And if you need to intensify this technique, you can try to stack the legs a little bit, and that will help to apply more pressure and force through the roller. Trying again on the other side, crisscrossing at the ankles, squeezing the legs together to help drive more weight through the quad. And we're breathing here as you roll the front of the thigh. You may want to pause here with the roller just beneath the waist to apply pressure through the front of your hip flexors. And this may be a nice way to end the rolling on your quads. Next, we'll roll the inner thighs, also known as the adductors, and placing the roller perpendicular to the inner thigh here. This positioning can take a moment, so allow yourself the time to get here. And then pushing the roller back and forth along the inner thigh here, using the other limbs of your body to help you stabilize, making sure that you come as close to the groin as possible as you navigate. You may find that you actually want to pause the roller in one place and flex and extend your leg to help you get a release through this muscle. Giving this a try and comparing it to how you feel with the rolling. Noticing the difference between the two, you might find that you like one versus the other. And again, taking your time back and forth, rolling from just above the knee all the way to the groin. And we're breathing here. And as we prepare to switch sides, take your time, setting yourself up for success on the second side. Perpendicular is the roller to your leg, and then allowing the rest of the body to help you push the roller back and forth along the inner thigh, from the knee to the groin. And be curious here, exploring where you can push your weight into the roller to help you get more of a release. And when you find tender areas, you may notice that you start to hold the breath, so making sure, again, of course, to keep breathing. And then pause here with the roller at one point in the thigh. Try flexing and extending the leg. And continuing to roll in a way that feels therapeutic for your body. And continuing to breathe. And then we'll transition to our final position here with the roller actually at the upper back. Now, oftentimes with pelvic health conditions, we think of only looking below the waist, but it's important to consider what's happening in your upper back. And if we can open up space here at the upper back, this can help the pelvic floor. So with the roller at the upper back, cradling the back of your head, use the roller as a fulcrum to extend your spine over. Feeling your way into this back bend and really mobilizing the top of your spine here. This can open up space so that you can breathe a little bit better. And then you can even lift the hips here and get a nice massage along the lower back and mid-back muscles by pushing the roller up and down the length of your spine. And then maybe pausing to set the hips down and stretch into the upper back again, letting the head hang. And as we finish here, you can certainly support the head and pull up a little bit to get a bit of a stretch here at the upper back. Breathing. Taking your time to really feel into this stretch of the upper back. And once you feel complete here, you can push the roller off to the side. And we'll conclude this foam rolling practice with just a few brief mindful breaths on your back. And as you breathe here, just noticing any sensations in your body that have shifted and noticing the muscles that you have now just rolled. Take your time here before you move on to the next part of your day.